Doctors are divided. Some call it a miracle cure, others say it's overhyped and overpriced. We're talking about hyperbaric oxygen therapy today, a treatment that puts you in a pressurized chamber and floods your body with pure oxygen and promises to restore hearing after sudden unexplained deafness. But does it actually work, or is it just another expensive shot in the dark? The truth, as it is so often in medicine, is it's complicated. And here's one thing to know right away. This isn't for hearing loss from loud concerts, aging, or long-term damage. Hyperbaric oxygen therapy is being studied for one thing: sudden sensorineural hearing loss. Today, we're going to break down the science, the controversy, and the real results, because when it comes to your hearing, the clock might be ticking.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
Before we can talk about a cure, we have to understand the crisis. What exactly is sudden sensorineural hearing loss? Sudden means just that. It hits fast, either all at once or over the span of a few days. Sensorineural tells us that it's not simply a blockage like earwax. It's damage to the delicate cochlea, that snail-shaped organ in your inner ear, or the nerve that carries the sound from the cochlea to your brain. For most people, it affects just one ear. Alongside the hearing loss, many people will experience a relentless ringing, a strange pressure in the ear, or sometimes dizziness or vertigo. And here's the frustrating part. In up to 90% of cases, doctors can't pin down a cause. They call it idiopathic. The leading theories behind this? A virus attacking the inner ear, or an autoimmune response where your body turns on itself, or, and this one's key, a sudden interruption to blood flow. Think of it like a mini stroke inside your hearing system. These fragile nerve endings in your cochlea are oxygen hungry, and if that flow gets choked off, they can suffer damage fast. That is why sudden sensorineural hearing loss is considered a medical emergency. There's a short window to act before the damage becomes permanent. Some people recover on their own. Studies show that a wide range, with some suggesting nearly 2/3, regain at least partial hearing without treatment. Others suggest that number is much lower. Either way, it's a gamble you don't want to take. So what's the first line of defense? Corticosteroids. These are powerful anti-inflammatory drugs, either taken as pills or injected directly into the ear, which aim to reduce the swelling and give the inner ear its best shot at healing. That's the gold standard. Everything else, including hyperbaric oxygen, gets measured against them. For some, steroids are enough. For others, the silence lingers, and that's where people start looking for alternatives. This is where hyperbaric oxygen therapy comes into play. A treatment that, to be honest, sounds like something out of science fiction. Here's the idea. You lay down in a tube-like chamber and the pressure is slowly increased to 2 or 3 times higher than normal air pressure. You'll feel it in your ears and in your chest. Then, for about 90 minutes, you breathe 100% pure oxygen, hoping those tiny fragile nerve endings in your inner ear are listening. The science behind it is fascinating. Normally, the oxygen in your blood is carried by red blood cells, and there's a limit to how much those cells can hold. But when you increase pressure, you force a flood of extra oxygen to dissolve directly into your blood plasma, which is the liquid part of your blood. This superoxygenated plasma can then sneak into areas where blood flow is limited, where swelling has closed off tiny pathways, places where red blood cells might not be able to reach. And that's the idea behind hyperbaric oxygen therapy for sudden sensorineural hearing loss. If the inner ear's blood supply has been disrupted, flooding the system with oxygen gives the body a new way to deliver the fuel. It's like setting up a temporary back road when the main highway is blocked. This oxygen bath could help reduce inflammation and give those damaged nerve endings the energy they need to recover. It's essentially a biological rescue mission. This is the miracle that patients and some clinics talk about, this high-tech, high-pressure chamber that might reverse what could otherwise be permanent hearing loss. A quick pause before we dive into the evidence. If you're finding this helpful so far, please hit the like button. It helps more people find this information when they need it most. And if you're into clear, no-nonsense explanations of real-world health questions, consider subscribing. Thanks. So what does the evidence reveal? A great theory is one thing, but in medicine, the proof is in the data. So what do these studies actually say? For years, the evidence was mixed. But now a clearer picture is forming thanks to large-scale reviews called meta-analyses, which combine data from many different studies. Patients who received hyperbaric oxygen therapy along with corticosteroids had 2.6 times higher odds of hearing recovery than those who didn't. And another huge analysis of over 2,400 patients found that 68% of those treated with both hyperbaric oxygen therapy and steroids experienced some level of hearing recovery, compared to just 49% of people who were in the steroid-only group. Complete recovery? Well, about 29% with hyperbaric oxygen therapy versus 21% without. So, yes, it works, but we need to pump the brakes on the word miracle. The results are encouraging, but modest. One study estimated the average hearing gain from hyperbaric oxygen therapy was about 10 decibels. Important, but not always life-changing. And timing? It matters. A lot. Hyperbaric oxygen therapy is most effective when started early, ideally within the first 7 days of hearing loss. After 14 days, the benefits drop, and after 30, they drop hard. Time is quite literally hearing. It also seems to work better for certain people, those with more severe initial hearing loss and those who didn't respond to steroids alone. On the flip side, people who also have vertigo with their hearing loss tend to do worse. And the good news, hyperbaric oxygen therapy is considered quite safe. The most common side effect is mild ear pain from the pressure, kind of like what you feel in an airplane as you're coming down. Serious complications are rare. By the way, we've gathered some excellent patient guides and research summaries on this topic, including how hyperbaric oxygen therapy fits into modern treatment plans. You can find those resources anytime at our Learning Center on utahhearingaids.com. So where do we land? Hyperbaric oxygen therapy is not a miracle and it's not magic. But for the right person at the right time, it just might be a second chance. And when you've suddenly lost the sound of your own life, the laughter, the birds, your children's voices, that second chance can mean everything. Remember, it doesn't work for everyone, but the science now shows that it can improve your odds of hearing recovery, especially when used early and in combination with steroids. It's effective, but not guaranteed. Hopeful, but not hype. The FDA has cleared hyperbaric oxygen therapy for treating sudden complete hearing loss of unknown causes, and the American Academy of Otolaryngology has included it in its guidelines as an optional treatment. If there's one thing you should take from this, it shouldn't be about one specific treatment for sudden hearing loss. It should be about urgency. If you or someone you care about experiences sudden hearing loss, don't wait. Don't assume it'll clear up on its own. Get to a doctor, get checked, get steroids started immediately. That decision opens the door to every other option, including hyperbaric oxygen therapy. Talk to your ENT specialist about hyperbaric oxygen therapy. Ask what's realistic for your case, what the costs are, whether insurance will help. It's not an easy choice, but it's one that's worth understanding. For clear, evidence-based answers about hearing loss and tinnitus, subscribe to our channel and visit our website, utahhearingaids.com. I'll leave a link below. I'm Dr. Layne Garrett. Take care of your hearing.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.